Good morning, Ms. Z. I'm Dr. Ryan and I'm the doctor in charge of your mother. I would like to update you in regards to your mother's condition. As you are well aware, she actually underwent dialysis.
Oh, yes, yes. I was informed. How did it go, doctor?
Alright, unfortunately, she developed a complication during her dialysis. She actually had a seizure, and that was due to a drop in her calcium levels as well as her low blood pressure.
Seizure? No one told me about this.
I understand this is upsetting for you and your family, but do allow me to explain what exactly happened and what we have done in light of the whole situation. As I'm sure you are well aware, your mother was experiencing severe fluid overload due to her chronic kidney disease. Despite the use of IV medications, her body wasn't responding as how we hoped it would. So we decided that dialysis would be the most effective way to remove this excess fluid. This decision did help her with her fluid level, and in that respect, the dialysis was actually successful.
But then the seizure happened. That's the problem.
You're absolutely right. The seizure was an unfortunate complication, and it is something that we deeply regret. Unfortunately, during dialysis, your mother's calcium levels dropped significantly, which contributed to the seizure. In addition to that, her blood pressure also dropped, which further complicated the whole situation. These are known risk factors, but they still happen despite our precautions as well.
You mean you tell me that this can all be avoided?
So potential complications from dialysis were anticipated, but sometimes the body reacts too suddenly. Things can escalate pretty quickly, but we responded quickly to stabilize your mother's condition, which includes correcting her calcium levels and also stabilizing her blood pressure, which then eventually stopped the seizure. Your mother's condition improved quickly after that, and she is now stable. Where could we have done better was to anticipate the potential for her calcium drop earlier in the process. While we did monitor her blood pressure and her blood calcium levels, we should have been more attentive in managing that from the get-go. There's some things we're addressing moving forward from here onwards.
But how can we trust you again after this?
I do understand that it is difficult to feel reassured after something like this. But do know, moving forward, we've made specific changes to your mother's care plan. First of all, we'll be doing more frequent calcium checks after dialysis. And secondly, we'll be using medications to keep her blood pressure more stable during the treatment itself. These adjustments aim to prevent this from further happening again in the future. What I can assure you is that we'll continue to monitor her closely and make any further adjustments as needed. I know it's difficult to regain trust after complication, but we're here to work with you and your family every step of the way.
Okay, thank you, doctor.